This first section talks about nursing and nursing information management. Information management in nursing and healthcare is not new. This is illustrated by Florence Nightingale. In 1873, she pointed out that information and recording information is important for any purpose of comparison, calculating cost of healthcare, but also for decision making. We all agree that nursing is an important link in the chain of patient care. Yet nursing is very information intensive. Evidence-based practices based on information literacy and high-quality patient-centered information also impact positively disease management. In addition, nurses are often identified as both the coordinators and providers of patient care. Yet, in order to do so, nurses need to find ways to capture, store, and retrieve patient data at any time of a health encounter. These data can be demographic data, assessment and diagnosis data, health insurance data, and so on. Data create information and forms the basis for planning the patient care and treatment, getting feedback on patients' progress, and suggesting actions for health promotion and disease prevention. As previously mentioned, data are necessary for planning patient care and treatment, and getting feedback on patient progress, and suggesting actions for health promotion and disease prevention. Yet, data alone is not sufficient. Nurses must understand the relationship between each of the data elements collected, and the data elements must be put in context. Data can only be put in context, and useful information can only be derived by adding the three following aspects: syntactic, semantic, and pragmatic. The syntactic aspect of information concerns the rules of conduct and presentation of the data, meaning the order of words and the way words are spelled. The rules of conduct are agreements and definitions made by the people adhering to the domain of knowledge. Semantic pertains to the meaning of the message. The semantic aspect is not interested in the way information is presented, but in its significance for decision-making and action. The meaning often can only be derived if we know the context in which the data are collected. Let's move to the pragmatic aspect of information. This means data are intentionally put in context with a certain goal in mind of decreasing uncertainty, testing hypotheses, deriving new knowledge. Let's move to the following example. You will never see in a patient record 65. The syntactical rules prescribe that the value be preceded or followed by a unit such as inches, pounds, kilograms, or so on. The semantic of that value, 65 pounds, depends on if the value is normal or not, given the context, like the patient age, height, history. The pragmatic assessment of nutritional status, initiating of deep tube feeding and or psychotherapy. And timeliness of information needs are not, but some general principles hold. For routine or simple tasks, where inputs, processes, and outcomes are perceived as known, information requirements are minimal, and information seeking is often considered redundant. The information for the problem solving is usually obtained through internal channels such as peers, other healthcare providers, or from a nurse's own memory. However, initiate information seeking. When need requirements are unclear, all available sources and channels must be considered, and novel sources are often identified to lessen the degree of uncertainty related to the task performance. More general purpose and novel sources such as experts, research literature, internet technology are considered and actually used for task performance. The value of information is for planning, controlling, organizing, and decision-making resource in nursing practice and care. It is specifically aimed at supporting the profession of nursing by avoiding negative aspects of patient care, increasing the understanding of the impact and effectiveness of nursing intervention, and thus conforming to developing of non-nursing knowledge. In addition, poor information usage and management tend to increase the workload and make healthcare professionals vulnerable to legal and professional problems. In nursing care, three main areas need to be considered regarding to the information. We need to consider the quality, accuracy, and reliability of the information sources used, the cognitive value of the information presented to the individual nurse in a practical situation, and the problem-solving aspect of the information form for the task at